Thank you very much. We want to thank the United Global Health Impact Consortium, the Work Package number 2, also the Poland presidency of the European Union. We are Francisco Bartolomé and I from the Ministry of Health, and we are going to present this. Our national...
So briefly, the strategy was developed as a joint effort by the Ministry of Health and the Ministry of Foreign Affairs here in Spain, together responding to what you have been discussing here about the current context and landscape of the global health with the humanitarian crisis, global health emergencies in a post-COVID environment, and together with the European Union Global Health Strategy, the WHO, the Agenda 2030, we developed this global health strategy. So if we can move to the next slide, we can see the 6 main strategic objectives. The next slide. Well, we can see the general objective, which is to ensure this commitment from Spain to global health and a global health that is effective, that is inclusive and sustainable, okay? And that contributes to improve the life of people by 2030. And as I said, we have 6 strategic objectives and 28 lines of action to achieve these objectives. So in the next slide, we can see a summary of the 6 strategic objectives. Okay, the first one is about, we have the guiding principles for this global health strategy, which are based on human rights approach. It's a feminist strategy based in multilateralism, cooperation and coordination among partners, with One Health and planetary health in the background, including health in all policies approach, and with the principle of no harm, okay, and also following the WHO social determinants of health, putting equity at the top of it, and following the 2030 SDGs agenda. Can we move to the next slide? As I was saying, here we have the 6 main strategic objectives. The first one based on the reinforce and strengthening of the public health, of the health systems that are public and resilient, and with a focus on, as discussed previously here by other partners, on universal health coverage and based on primary health care and the communities. Okay. In the second one, we want to support and contribute to the promotion of health and well-being and living conditions across all life course, okay? Fostering disease prevention and control, and as I said before, on top, having equity approach as the pillar for all these objectives. Environmental health and climate change, having a comprehensive approach, planetary health approach, and trying to achieve public health impact, okay? The fourth objective would be to promote and prevent crises and respond to humanitarian health crises across the globe. Okay, and then the fifth would be about promoting stronger and efficient global health governance and architecture. For this, Spain is really committed, okay, in collaborating with other actors and create networks and facilitate the progress towards equity, health equity in all countries. And the last one would be to foster research, innovation, and the digitalization of health systems and health, okay, with an equity perspective as the cornerstone and the driver for global health, this new digitalization environment. So now Leticia will talk a bit in depth of the lines of action of each objective. If we can move to the next slide.
Yes, for the first strategy objective for resilient and public health system, we have 3 action lines, and the first one is to have a collaborative leadership and governance models for health policies, and the second one, promote the provision of healthcare with equitable access and no discrimination, focusing on primary and community healthcare. And the third is about healthcare workers, and training programs responding to needs, and also strengthening local capacities. So we can go to the next slide. And for the second strategy objective is about health promotion and well-being, life course approach. And we have different action lines that we have mentioned before in our European strategy. So we can highlight the first one, for example, about the use of the social determinants of health in the design of health policies, improving access to water, nutrition, and reduces inequalities. We can go to the next slide. For the third strategy objective about environmental health and climate, we have 4 lines to take action. It's about the strengthening resilience and sustainable health system adapted to climate change. One health approach to address resistance, antimicrobial resistance, use of phytosanitary products and zoonotic emergency diseases, advance of mitigation and adaptation policies toward climate change with planetary health approach, and global cooperation to coordinate public health response in adverse climate events. Our 4th strategy objective about health emergency, preparedness and response, we have 4 action lines. There are support partners and international organizations to strengthen prevention, preparedness, and respond to epidemics. Contribute the development of basic capacity of international
health regulations.
The third is about development of tools of pandemic response, ensure equitable access to control measures and epidemiological information. And the last one, quick and effective development of humanitarian aid in response to crisis. The 5th strategic objective, a stronger and effective global health governance towards health equity. We have 4 action lines, and the first one is international financing and equity, sustainability and cooperation approach, progress in development of international capacity for preparedness and response to global health challenges, strengthen the presence of Spain in European and international platforms health-related, and promotion of strategic bilateral cooperation at regional level and with partner countries. And the last one of our strategies objectives is this one, and is about foster applied research, innovation, digitalization with equity as cornerstone. And we can highlight the action line of digitalization of health system at international level, supporting partner countries in the implementation and increasing the use of digital technology contribution to regional and global networks. For our national strategy, we have planned the implementation and monitoring and evaluation and governance. And for implementation, we estimated multilateral meetings, but also bilateral and regional and European. For monitoring and evaluation, we estimated an evaluation for midterm between in 2 years period, and also final evaluation with different committees. And for governance, we have interministerial committee, also an executive board and advisory group. So thank you very much for this conference and the opportunity to present our national strategy that, as was said before, it was signed and released just 1 week and a half or 2 weeks. So for us, it's a pleasure to be here with us to present our national strategy.
Thank you very much.